I am Dr. Drsaimakhan, and today I will present a case in which a patient came with severe pain in the C-section scar. On ultrasound, we could see a subcutaneous heterogeneous collection below this C-section scar. As we can see, there is a heterogeneous mass in the subcutaneous tissue. Multiple echogenic foci are seen, and these may indicate gas, suggesting infection, calcification, or fat component. We can also visualize debris in this mass, which suggests necrotic tissue, pus, or blood clot. This mass has ill-defined margins and may indicate infection or inflammatory changes. Doppler flow shows minimal vascularity. Posterior acoustic shadowing can also be visualized, and this may be due to calcifications, foreign body, or dense fibrosis. Let's discuss the possible differential diagnosis. Post-Cesarean hematoma is a possibility in such cases. The cause may be bleeding from the surgical site or vessel injury. In these cases, hypoechoic to heterogeneous mass with internal debris may show evolving clot. No internal vascularity can be seen in such cases. Post-surgical abscess may also be considered in such cases. Bacterial infection of surgical site is the basic reason. In these, hypoechoic to complex collection with echogenic foci, which are the gas bubbles and debris, is visualized. Peripheral vascularity or rim enhancement is seen. In such cases, clinical features are fever, arrhythmia, pain, tenderness, and purulent drainage. Management is antibiotic, incision, and drainage if necessary. Another differential is suture granuloma. The cause of this is foreign body reaction to sutures. On ultrasound, small, well-defined hypoechoic masses with possible shadowing from suture material is visualized. Doppler shows mild vascularity. Clinical features show firm nodule at the scar and may have chronic low-grade inflammation. Fat necrosis. Post-surgical ischemia or trauma to adipose tissue may cause fat necrosis. Ultrasound shows irregular hypoechoic mass which may have cystic areas. Clinical features in such cases is painless or mildly tender lump. Management is conservative, usually self-resolving. C-section endometriosis may also be seen post-operatively. The cause is implantation of endometrial tissue at the surgical site. Ultrasound shows heterogeneously hypoechoic mass with possible cystic components. Clinical features are cyclic pain, during menstruation, firm mass. Management is excision if symptomatic. Differential of seroma should also be considered. The cause is accumulation of sterile fluid post-surgery. Ultrasound shows anechoic to mildly hypoechoic fluid collection without any debris or vascularity. Clinical features are soft, painless swelling. Management is observation or aspiration if symptomatic. Foreign body reaction can also occur in such cases. The cause is retained surgical material like gauze or sponge. Ultrasound shows echogenic mass with shadowing, sometimes with surrounding fluid collection. Clinical features are chronic non-healing wound, pain, and discharge. Management is surgical removal. Further investigation through Doppler ultrasound, culture and sensitivity, MRI if needed, complete blood count, C-reactive proteins for further evaluation. What is the management approach? In mild cases, observation and follow-up ultrasound. In infected cases, drainage and antibiotics are combined. In cases of large hematoma, possible aspiration or surgical evacuation is needed. In suture granuloma, endometriosis, or foreign body, surgical excision if symptomatic. Kindly remember to like, subscribe, and follow the channel. Thank you.